Deciding about the type of introduction you'll make or not make during a role play depends on the scenario of the role play. You'll find this information in the context box before the task bullet points. At a simple level, you'll find out if you're speaking to a patient, parent of a child, or carer. Next, look at where the patient is on what we call the patient journey. Are you speaking to a patient before an operation or after an operation? Has the patient just come to ED and you're speaking to him or her during triage? Are you a community nurse speaking to a patient during a follow-up visit? Now think about whether you need to introduce yourself and explain your role or not. During a first contact, you'll introduce yourself and explain your role. If the context box makes it clear that you've already examined the patient or you've already taken clinical observations, then introducing yourself makes no sense. It's understood that you've already done that. If you do start introducing yourself, it will be clear that you haven't understood the context of your role play. Another important point is that when you go through initial checks with the interlocutor, you'll ask how the interlocutor wants you to call him or her. The interlocutor will confirm their preferred name, usually a first name. They may say something like, "You can call me Susan" during the role play, or "It's okay to call me John" during the role play. This means that you shouldn't waste time asking them about their preferred name as you start the role play. They've already told you. Now let's look at some examples of introductions you might make during a nursing role play. Example 1, the scenario. A patient is in hospital after an operation. He or she has asked to speak to a nurse. The task bullet point 1, find out reason for patient's request to see you. Planning the role play. Do you need to introduce yourself and explain your role? Yes, you need to introduce yourself and say what your role is on the ward. Then you'll move quickly onto the first bullet point.
Hello, Judy. My name is Peter. I'm one of the ward nurses. Can you tell me why you wanted to see me?
Yes. The pain medication I was given half an hour ago isn't helping and I'm still in a lot of pain.
Example 2, the scenario. A patient has come into ED after a minor sports injury. You are a triage nurse and are speaking to him or her for the first time. The task bullet point 1, find out reason for visit. Planning the role play. Do you need to introduce yourself and explain your role? Yes. You need to introduce yourself and explain that you are one of the triage nurses in ED. Then you'll move quickly onto the first bullet point.
Hi. My name's Samira. I'm one of the triage nurses in ED. Can you tell me why you've come to the emergency department today?
I was hit in the head when I was playing football and my friend was worried about me and brought me here.
Example 3, the scenario. A patient has been in hospital for abdominal surgery and is ready to go home today. You are a ward nurse who is providing discharge information to the patient. The task bullet point 1, confirm reason for seeing patient, in brackets, providing wound care information, providing information about discharge medication, close brackets. How are you feeling? Planning the role play. Do you need to introduce yourself and explain your role? Yes. You need to introduce yourself and explain that you are one of the ward nurses. Then you'll move quickly on to the first bullet point to confirm the reason for speaking to the patient.
Hello, David. I'm Roberta. I'm one of the nurses on the ward. You're ready to go home today, so I'll go through your discharge information with you now, if that's okay. I'll explain about your wound dressing and also about the new medication you need to take for a while after discharge. How are you feeling at the moment?
I'm relieved to be getting home, of course, but I'm a bit worried about coping with the dressing on my own.
Example 4, the scenario. A patient is in hospital and had an operation the day before. You are a ward nurse who has come to take the patient's clinical observations. The task bullet point 1. Confirm reason for seeing patient, in brackets, clinical observations, measuring urine in catheter, close brackets. How are you feeling? Planning the role play. Do you need to introduce yourself and explain your role? Yes, you need to introduce yourself and explain that you are one of the ward nurses. Then you'll move quickly on to the first bullet point to confirm the reason for speaking to the patient.
Hi Debbie. I'm Ivan, one of the ward nurses. I've come to do your clinical observations and measure the amount of urine in your catheter. How are you feeling?
I'm glad the operation's over, but I can't seem to get comfortable at all.